Hey guys, Dr. Brotsky here. Welcome to week number 8 of your pregnancy. If you haven't checked out the previous videos, make sure you do that. Right now, your baby's about the size of a raspberry, so definitely growing and getting bigger. Things you may be noticing right now are consistent symptoms in the first trimester, which include fatigue, nausea, possibly vomiting, acid reflux, constipation, bloating, all that fun stuff. But it gets better, I promise, so just hang in there. The other thing you might start noticing at around 8 weeks or so is lightheadedness and dizziness when you stand up for too long. This is just because the blood pools in your legs as your veins are getting a little bit lazier in pregnancy, for lack of a better word. So when you stand for a long time or you sit down for a long time, gravity makes all that blood and fluid pool in your legs, and you may find that you have to elevate your feet from time to time. From a doctor's perspective, at about 8 weeks, we can see the baby with the heartbeat very clearly on the ultrasound. You might also start talking with your doctor about dietary restrictions. Things I usually go over with my patients are making sure they know that they're taking their prenatal vitamin every day for those extra vitamins and minerals that are recommended and vital in pregnancy. The other things that you need to keep in mind are you need an extra 300 calories a day when you're pregnant, which is not technically eating for two. So I always tell patients it's about the equivalent of a half a sandwich and a glass of milk, so it's not a ton of extra calories. And you should be eating those small, frequent meals, which will help. The other thing you need to keep in mind with your diet is that you want to avoid any raw fish, you want to avoid any unpasteurized cheese, and as a precaution, just heat your deli meat. Make sure it's steaming hot before you eat it. Once it cools off, then it's fine to have, okay? So those are the major dietary restrictions. If you are wanting to eat fish and it's cooked, that's usually okay, just no more than twice a week. 2 6-ounce meals a week are allowed, and that also includes the chunky light tuna, just no albacore because it does have more mercury in it. If you have any other types of fish that you eat, you want to check with your statewide wildlife and game to see what the mercury levels are in that area to make sure that you are keeping it under the recommended amount during the pregnancy. For activity during this time in the first trimester, you really can do anything you did before you were pregnant, as long as you weren't like a skydiver or an extremist with your activities. So you can have intercourse, you can go swimming. You need to skip out on hot tubs though, because that will change your core body temperature, which does matter for your pregnancy. If you're used to exercising, the main precaution I give my patients is not to increase their weight that they're lifting now and to maintain what they're used to lifting, because your ligaments are more prone to injury when you're pregnant. The other thing to keep in mind is if you do cardio at all, you want to keep it under the 80% maximum of your heart rate. So typically your max heart rate is 220 minus your age, so you want to keep it less than 80% of that number, and then you're safe. As usual, drink lots of water. Other things you need to be looking out for: bleeding and severe cramping, like I've mentioned before. You can also take some over-the-counter Tums, usually if you start getting acid reflux, that can help. And just make sure you get all the rest you need. As usual, thank you so much for checking out my video. You can always check me out more on drbrotsky.com and check out my other videos on this channel as well.